Amidst the confirmation of the death of Dr. Wenliang, who initially sparked concern about coronavirus, we look at how this information or concerns by medics is dealt with by authorities. Today I'm going to be talking about today's announcement, the death of Dr. Wenliang, a Chinese doctor who has died after contracting the coronavirus while he was treating patients in the Wuhan hospital where he worked. The irony, his death has sparked unprecedented levels of public anger and grief within China, admittedly, because he was one of the initial medics who suspected that this new virulent virus named coronavirus was similar to SARS, the severe acute respiratory syndrome. And he did initially do his best to disclose his concerns, but apparently, again, it's very normal that experts will have discuss issues or topics within their peer groups, and he did this. He mentioned his concerns within his medical school's alumni group on WeChat, a social network similar to, I suppose, Facebook or Twitter, social platform. And unfortunately, his concerns were considered to be misinformation, and he was detained by local police, subjected to being reprimanded for spreading rumours which were false. And again, this is remarkable. Regional authorities do not seem to be, it's not just applicable to one specific country. I suppose this could happen in any country, especially if there isn't a degree of understanding about how to pass on information which really is highly sensitive, and government authorities, public health authorities, need to have processes and procedures in place that where any expert from any field can, whether it's within health, whether it's within environment or animal welfare, where things can be escalated as or drawn to the attention of the governments. This particular doctor, he did try to sound the alarm. He had his suspicions, but obviously one single doctor cannot make that much of an impact. And of course, he was sharing his concerns with his peers, just to probably, again, through his analysis, I assume, all the similarities with the patients he was treating and their symptoms, wished to just discuss this, and he was shut down due to ignorance, really, or lack of knowledge, lack of internal procedures for passing on information. And the result is that this infectious disease has now, again, it's not running rampant as such, because authorities all over the world have done, and governments have really done their best in collaborating with passing on information, transparency of the numbers who are contracting and this disease, virus, coronavirus, and the number of fatalities are being reported in real time. So it's a very sort of coordinated response to, would have been quite a awful outbreak, which could have affected potentially millions globally, is being and victims could have, disease victims, which would have been unsustainable, really, to deal with the numbers of fatalities if this sort of global cooperation wasn't taking place at the moment between governments. But getting back to the point, it is important that Dr. Li Wenliang his death has brought up or triggered a conversation about shortcomings and deficiencies that governments may have, and really do need to scrutinise about medical staff, doctors being able to report suspicions about new viruses or new infections, which rather than sort of shut down reporting, they should in actual fact encourage it through transparency and not be reprimanded, because that is in absolutely no one's interest, whether it's the public's or a government's. However, he posthumously, it has actually globally had an effect, I think, within a lot of media outlets. People are expressing, their remorse that he's actually not one of the victims which have recovered from this, but he's now, one of the number of fatalities, and it's putting a face to this new virus epidemic, which could possibly be an epidemic, but it has been managed by authorities very well at the moment, with the coordinated response. People are being regularly tested and monitored. Medical advice is being issued for self-isolation and this is throughout globally, throughout the world, and the World Health Organization, who officials are ensuring that protective masks and medical supplies are sufficiently being produced within the supply chain, and their distribution in areas which require them, which necessitate them, essentially, especially within certain provinces and countries where there have been cases of people who have contracted the coronavirus. We'll have to see how this develops in due course. It is could consider as sort of a flashpoint in for many countries to consider how they deal with suspicious of new contagions or viruses, how authorities deal with these individuals, and how diseases are contained, and countries cooperate to ensure that these new viruses, which can be very virulent, do not turn into a global epidemic. Thank you for tuning in to today's episode. You can subscribe to the Commons podcast via iTunes, Spotify, and other major providers.